don't require more than 30 seconds. Now when you are treating for particular one joint only, we don't require much more time. And maximum on the whole also, if you are treating any person, it may not be more than 3 minutes only. Within 3 minutes we can cover up the whole treatment. And so I feel it is a good approach of this science and we are getting benefit. Now here you see whatever work is done by our gurus and other, what we can say, acupuncturists, they have given all the information, we are getting benefit of it. This is ready material for us. So I give advice to everybody also, we must try this only. Now it is small, say, I am giving one example, problem with the stomach. Any time due to heavy food or due to any other acidity problem, sometimes it is very painful. So how to relax that muscle? Once you relax the muscle, the pain also will reduce and they will feel better also. Only thing is, if it is very tender pain, the tender pain is unbearable to touch also. That time we should not take a risk. Now when I know I can treat my patient, but when you don't do, you don't treat that patient. Now if there is a problem with the hernia, in that case we cannot take a risk. Whatever, if there is an obstruction of the intestine, you cannot judge yourself. Even X-ray will not show you the proper picture unless and until they open it. So it is better, where there is a very tender pain is there, we should not touch. And you can have some other approaches, so that is what I can feel. But in that case also I got another approach, the simplest method, that is a moksha. I come to that afterwards. So this is the first approach with a cup only, where you can get an immediately benefit also and comfortable also to treat patients. And they will accept us as science. So that is my first interest to use this vacuum cup therapy. Okay? If any doubt is there, you ask me afterwards. First we cover the subject and we will go ahead. Okay? But what is vacuum therapy is a very simple technique. And it works wonderful also. So my first choice is with the vacuum cup therapy. First is homeopathy, that is a medicine side. But therapy wise, if you ask me, first is this, second is moksha, and the third is I prefer sujok. Now sujok therapy, no doubt, is a wonderful. It works as a miracle only. But it is painful. So people will not accept that sujok therapy. So these two they will accept immediately and we can see the benefit also. That is what I found it. So this is about the vacuum therapy I told you. Now this moksha, one thing we have to keep it in mind. If the person is doing a fracture, in that case also we should not do the moksha therapy. Now if there is a problem in between the bigger bone, the fracture is there. Sometimes hip joints also, that you can see the, after the X-ray only you can judge, otherwise you cannot judge immediately. There also I request you don't do this, vacuum therapy. Then if there is a problem related to the skin trouble, having eczema in that area, it will be very painful for them. So for that moment, or instead of that point, you can go for other side and treat a patient, they will get a benefit. Now when you are treating on, suppose the problem is here. Now I tell you one example. One person having a fracture over this and he was having plaster over this. He was having a pain over this. Now he was not able to ride also, for more than 1.5 months. He was not able to see the benefit of the as if that it is as it is only. Then he came to us actually somehow. They have treated on the left side only. And just within 2 days time we got a 70% relief. So when we are treating on our acupuncture therapy side, therapy is either acupuncture or acupressure you can say, you get a benefit from other side also. Only thing is you have to give it more time. 2 days time we got a 70% relief. So when we are treating on our acupuncture therapy side, therapy is either acupuncture or acupressure you can say, you get a benefit from other side also. Only thing is you have to give little more time. Other side, you get a benefit. Weight works wonderful. So this is for your knowledge also. If you cannot do on the other same side, you go for other side also. That is very, very important. As it is also, when you are treating any particular area, say person is coming for the right side neck head. So here naturally we should give little more time. If the person is having a problem and they may not allow us also to have a treatment, but you give little time on this, give other side treatment, and as it is also we require treatment on both the side. I prefer treatment should be on both the side, and they must get a benefit of that also, and same day they must get a 30 to 50% relief. In the case of acute trouble, say like the cervical spondylitis, first day only they must see the relief by 30 to 50% only. Then and then I am saying you have selected proper point only or acupuncture points you have selected. That is a right approach, you can say like this. According to acupuncture therapy, we can say is a judicial point. Judicial point means you have selected like that medicine should be proper. Now when you give some medicine, it should be proper medicine, then and then you will see this result same day only. Otherwise, but you don't see the benefit of it. So I prefer you have to select a point in such a way a person must get a benefit with that point only. So that is the first part. So that is for the vacuum therapy I have done. Now I am coming to the moxa. Now moxa, see this is you can say it's a herbal remedy only. Herbal remedy in the sense what you call Artemisia vulgaris. It's a very specific medicine. Can you have equivalent? There are so many other products maybe there in the market. The thing is, this is specifically when you treat to anybody or when you see the working of the system, it gives a very good hit. With even 1.5 inch away, it will be a distance of 1.5 inch away, you get the same hit what we can even direct you apply. You sometimes you don't find a benefit, you don't use it actually, but you don't get a benefit. Here you see with this, you can see the relief within 10 seconds only. You don't require more than 10 seconds. Now when you give little hit in the sense, okay, we select acupuncture points. Acupuncture points in the sense, when you are treating, say I am giving one example for asthma. I prefer this is a point first. So you select this point first. And keep just for 10 seconds only. You will see the benefit. Within 10 seconds, person will tell you, oh, I am feeling something better. I will not say it is a cure. And then breathing problem, no. The heaviness of the chest or nose or something, they will feel something lighter. They will say immediately they agree also, I am feeling better. Now this is my first effort. Now this particular point, what I call it actually immunization point. When you apply all this for 5 to 10 seconds, you get a benefit of this. Now that heat, actually what happens when you keep it all that particular point, we are stimulating that particular point instead of needle. Now people are having out, nowadays it's a sort of a what you call infection of the needles. So they don't think about needles actually. Now when you prick the needle in particular depth only, now when you prick the needle in the sense like this needle is there, you prick the needle, you keep it for 20 minutes, then you will remove the needle, it takes time. Yes, within 10 seconds or maximum 20 seconds, we see the benefit of that. Now that benefit in the sense, the person will or patient will tell you, oh, I am feeling something better. And what we are trying to do that we must see the benefit within short period only. Now we combine not with one point, you can say, combination of this 1, 2, 3 plus this 4. This is my choice. That with these 4 points on both the side and with 3 minutes, maximum 3 minutes, we see the benefit of that. That's all. It is what we want to give benefit to all patients. Right? Now here see, it don't require what you call in the case of acupuncturists, they must learn what particular needle they should go what they require sometimes stimulation. Now in the stimulation also there are gadgets. You require gadgets also. Now here you don't require anything. Now nowadays I feel about 10 years we are getting this thing Chinese what you call moksha. Earlier we were not getting moksha in the market also. If I want to teach somebody, even if I know the science, if anybody is coming from China or Hong Kong or Korea, they may believe. Correct? Quality wise also good enough actually, but that is not available. Then what will you do? I tried with the cigarette also. One secretary, one of my friends, he was having a backache. For 2 days he took what you call painkiller actually, and he didn't get a relief of that. Then I said, you first I will smoke cigarette, I will be little relaxed, then I will give treatment. So first you place the order for 2 cigarettes. He asked for the cigarette, he got 2 Charminar. That is, I was not knowing, but I said, oh, you asked for Charminar, it is a strong medicine, and I will relax with that only. He placed the order, I got a cigarette, 2 cigarettes. Now you won't believe, first cigarette only, I tried with him only, because that time moksha was not available. He got a 30 to 40% relief, and with second cigarette also I treated on both the sides. He was having lumbar pain. I treated with the hand only, not foot. Actually my choice is always with the foot only, but in his case because we were in the office only, so I treated on both the sides. First day only he got about 50 to 60% relief. Next day morning he gave me Doctor, I got a relief, but please come today also at my office and give me treatment today so I get some relief today only. And you won't believe, second day I treated also, and then he was not able. Now that was acute trouble. It was a muscular pain only. I was knowing that's why we got a relief. You see, when an elderly person is there, if there is a problem with the lumbar, what you call space is reduced, some problem with the case also like that. So many factors we have to consider. Yeah, you see, that was not a problem. And he got a relief. So I'll say if you don't have this moksha, you can manage either with that agarbatti is available, thicker one. Instead of thinner, no, go for thicker one. Yeah, you don't require more than 15-20 seconds also. We can treat to anybody. Now when we are treating with a rod, say for in the case of acupuncture, people, it is a very painful. People, they don't accept also. They will say, we don't want this treatment. We do it with some other gadgets. So in that case, I will say elderly person also. Those who are elderly, say more than 70, 80 years old. You cannot treat properly. You cannot give more pressure also. You can't use any gadgets also. I prefer this gadget, moksha only. And we can treat very comfortable. That is, I have found actually. But it works wonderful. And instead of going for the roads and other things and other gadgets, you can manage with this. Now suppose you don't have anything and you require at home somebody having a little pain, neck pain. In the morning, we get a catch of the neck or sometimes back also. Now with the foot only, when you treat, just treat 2 fingers, extending 1 finger above. Backache is there. First, within 15-20 seconds only person will tell you, I am feeling better, they can walk very comfortable. Those who are not in a position to sit very comfortable for longer time, treat over this and ask within 10-15 seconds, he will say on both the sides and we get a benefit of this. So what you call, how we can get a best result and with short time and what you call, maximum benefit, what I want, maximum benefit. And when we are treating to somebody, we treat, explain to your patient what we are doing, for what purpose and for what location we are treating. So they understand very well. So they can do it home also. With anybody's help also they can do it actually. So what I want, if it is not available, you can use our agarbatti also, we can get a best result. Now cigarette, I will not give adult because nowadays it is restricted for each and every area. So otherwise, why